When it comes to the world's AIDS crisis, no region in the world is more impacted than sub-Saharan Africa. We have this report now from Rene Carme in South Africa.
Close to 300 to 400 people die of AIDS-related illnesses in South Africa every day. The South African Health Ministry hopes to expand its HIV/AIDS treatment program from 1.7 million people at present to 2.5 million by 2015. Government, HIV/AIDS activists and health practitioners agree that the country has come a long way since the first diagnosis and discovery of HIV/AIDS about 30 years ago. South Africa has moved from a period of so-called HIV/AIDS denialism to a more progressive approach when it comes to treatment, counseling and testing for the virus. Yet many who are infected are still too embarrassed to seek treatment, mainly because they fear being ostracized by friends and family. Mpho Mazimane has been living with the virus for 20 years after being infected by the father of her eldest child.
My mother kicked me out of the house. I stayed with relatives. Relatives also, they were so scared of me. Also they didn't even want to touch anything or never mind being close to me. I was in the bedroom with my son all the time. If it's time for food, I will come with my plate. They will pour for me and then give me, go back to the room. So I was like in jail.
Dr. Cindy van Zyl and her colleagues at this non-governmental organization near Johannesburg are in the business of fighting discrimination and denial around this devastating disease.
The real change came when I was working at Chris Hani Baragwanath Hospital in Soweto, the biggest hospital in the Southern Hemisphere. And that was in 2006, and the death and despair that I witnessed there did something to me. It broke my heart.
She's determined to educate and train as many nurses as possible to run HIV treatment programs, especially because South Africa does not have enough doctors to do so.
As recently as 2009, there was a waiting line for medication. So you'd wait for like 4 months to get treatment. So we had to move it away from being a doctor-centered program to being a nurse-run program. And through that, we've had many more people on treatment. I think so far in Soweto, we've trained over 1,000 nurses.
Dr. Cindy also has a blog aimed at breaking down barriers such as stigma and ignorance, offering advice to those who are infected or affected by the virus.
Even beyond the country, I would like this message to reach the whole world, that HIV stands for hope is victory. If you don't have hope, then you're lost. HIV is not a death sentence. It's a chronic manageable disease. You just have to embrace it and live with it.
Rene Carme, CCTV, Johannesburg.